Hi guys, this is Courtney, one of the breastfeeding peer counselors from the WIC office. I'm just here to talk with you today about how to initiate breastfeeding after birth, how to get a good latch, how to tell if baby's getting enough breast milk, just really how to get started with breastfeeding. So we're going to get going. Alright, so the first thing that we recommend once baby is born is that you do skin to skin with baby. And that's what this mom here is doing. Her and baby are just snuggled up. Baby's down to just a diaper. Mom's got her top off. And they're really just snuggled in, getting to know each other. We recommend that you do skin to skin for the first hour after birth or until baby has his or her first feeding. We want you to do skin to skin as much as possible while you're in the hospital and once you get home with baby. And if you have to have a C-section and you can't do skin to skin with baby right away because you have to go to recovery and they won't let baby go to recovery with you, it can be done by dad or grandma or another support person there at the hospital with you until you and baby are reunited. And the benefits of skin to skin for baby: it helps stabilize their heart rate, regulates their breathing, improves baby's oxygen levels, regulates their body temperature, it reduces their stress, they cry less, which helps stabilize their blood sugar levels, and it promotes bonding. For moms, promotes attachment and bonding, helps to bring in and increase mom's milk supply. It improves baby's latch, which makes mom more comfortable. It increases sensitivity and responsiveness to your infant. You know, with baby right there on your chest, you can't help but know every little thing that's going on with them. And it boosts your confidence in providing care and transitioning to home. As far as milk production goes, the colostrum is the first milk that you make. You start sometime around 20 weeks into your pregnancy. That way, if baby comes early, you already have milk there ready for baby. But it's the first milk produced in the weeks before delivery and in the early days of breastfeeding. It's really the perfect first food for baby. It's low in fat and high in carbohydrates, proteins, and antibodies. It's extremely easy for baby to digest. It's high in concentrated nutrition. There is not a ton of it, but it's really power-packed with everything that baby needs to get off to the best start. It has a laxative effect to help baby pass meconium, which is that really first tarry, black, sticky, poopy diaper that they have. And so clearing that out of baby's system helps to prevent jaundice. And it's also considered baby's first immunization because it's power-packed with all kinds of antibodies and antiviruses and anti-parasites and everything to just really keep baby very healthy. And it's important in protecting baby's gastrointestinal tract. Babies have what we consider very leaky guts. They're just very open and very easy for bacteria and things to get in there to make baby sick. And so that's one of the reasons why that colostrum is so thick and so sticky, is it really gets in there and it coats baby's intestines. And it keeps that bacteria from being able to get in there and be able to penetrate into that gut wall. And then those antibodies help to fight that off also. So really the perfect first food for baby. And then the mature milk arrives somewhere between day 3 and 4 after birth. So you're really going to notice a big milk supply increase around day 3. Now that colostrum is really increasing from that very first feed. From the first time baby nurses, that the amount of that colostrum is going to be increasing slowly. But about day 3, moms usually notice a much larger increase in that milk supply. So around that time you may notice that you may be a little bit engorged, or you may notice more leaking, that baby is getting a larger amount of milk around that time. So we really want to aim for baby to get that first feed in the first hour after birth. The oxytocin that helped birth baby also moved the colostrum down the milk duct, so a large dose of colostrum is waiting for baby. The amount of colostrum available to baby in the first hour after birth is 4 milliliters. If mom waits to breastfeed until 6 hours after birth, the amount available to baby drops to only 1 milliliter. So if mom is unable to breastfeed right after birth, then it is imperative to pump in that first hour to take advantage of that large dose of colostrum. Now, some babies, right at that 60-minute mark are not quite ready to nurse yet. Sometimes babies are a little bit slower to kind of wake up and be ready to nurse, and that's okay. It's usually somewhere between that first hour, hour and a half that most babies are awake and alert enough to nurse. So if you and baby are still together, still skin to skin, that's okay that baby hasn't nursed quite yet at that 1 hour mark. But if baby has been transferred to the NICU or transferred to another hospital and you don't know when you are going to have a chance to nurse baby, then go ahead and ask for a pump and start pumping so that your body gets that signal that baby is here and you need to start working on getting that milk in. Some babies are just a little bit slower with nursing, and that's okay. But if you aren't going to have the opportunity to nurse baby, then we need to start pumping within that first hour and then pump every 2 to 3 hours after that, just like baby would be nursing. We really encourage exclusive breastfeeding. That's really going to be the best thing for mom's milk supply. So what is exclusive breastfeeding? From birth to 6 months, the infant receives only breast milk, no other food or drink, not even water, for the first 6 months of life. And then from 6 months to 1 year, infants should receive nutritionally adequate and safe complementary foods while continuing to breastfeed for the first year or beyond. No formula is offered. So once baby hits 6 months, we start baby foods and table foods while continuing to breastfeed for at least a year. So why is exclusive breastfeeding so important? Exclusive breastfeeding ensures that mom's body is able to produce the amount of breast milk baby needs. So when babies are born, their little stomach is teeny tiny, about the size of a little marble. And it only takes about 5 milliliters or about a teaspoon of liquid to fill that little belly up. And as we had saw on that slide before, in that first hour after birth, mom produces about 4 milliliters of colostrum, which is really the perfect size feed for that tiny little belly. And as long as mom is nursing the baby at the breast at each feeding, baby's going to get that little bit of colostrum. And as long as they're just nursing at the breast, that little belly is going to stay that size and it's slowly going to stretch it's slowly going to expand as mom's milk supply increases. But we have a lot of moms that worry that little bit of colostrum isn't enough for baby. So they will supplement with formula on top of nursing. And what that does is that prematurely stretches that tiny belly out, really bigger than it needs to be. And so then when mom goes to nurse baby at that next feeding, and maybe mom has, say, 6 milliliters of colostrum, but maybe baby got 15 milliliters of formula, supplemented at that last feeding. So baby's belly has been stretched out bigger than it needs to be. So baby is still hungry after it nurses. And so what's mom going to do? She's going to supplement with more formula, which is going to stretch baby's belly out more. And so it just causes this kind of snowball effect of moms having to supplement more and more and kind of struggling to keep up with the amount of milk that they are producing. That formula also takes longer to digest than breast milk, so baby will want to nurse at the breast less frequently. We really want babies to nurse frequently in those first couple of days and weeks, because every time baby nurses at the breast and drains that breast, it sends a signal to mom's brain that tells mom's body, this baby is eating, this baby is hungry, we need to make more milk. And in those first couple of days, that's going to help mom's milk come in quicker. But if baby is filling up on formula, they are not going to need to nurse as often. And so mom's body isn't going to get that signal that it needs. So we really want to exclusively breastfeed so that mom's body is constantly getting that signal that baby is eating, so that mom's body knows that it needs to produce a lot of breast milk for this baby. So don't break the chain. This is kind of the natural cycle of events that happens when a baby is born. A baby's born with a tiny belly, about a teaspoonful per feeding. Mom's going to produce small amounts of colostrum from days 1 to day 3 or 4. Baby's going to nurse frequently, probably every 1 to 2 hours due to having such a tiny belly. And this is the most common point where moms kind of panic a little bit and are afraid they don't have enough for baby and they will supplement with formula. But we don't want mom to do that. We want mom to just keep nursing baby on demand. No matter how long it's been since that last feeding, nurse baby again. Mom's body is going to respond to baby's hunger, and mom's milk supply is going to increase around, or you'll notice a bigger increase around day 3 or 4. So when formula is offered in place of nursing, mom's body does not get the signal that baby is hungry. This results in lower milk production. So how do we know if baby is getting enough breast milk? This is really stressful for a lot of moms. When you're bottle feeding, you can see exactly how many ounces baby has taken. But when you're breastfeeding, there's really no gauge that says this is exactly what baby has taken. So these are the ways we at WIC kind of tell how things are going. These are the questions when you come in for your mom and baby appointment that we are going to ask to kind of tell how breastfeeding is going. So we want to see baby back up to their birth weight by the time they're 2 weeks old. It is normal for babies to lose some weight in the hospital after birth. Kind of really normal for babies to lose weight up until about day 5 after birth. But then we want to see that they are putting that weight back on. Anytime you guys are worried about baby's weight, you are welcome to bring them into the WIC office and we can get a weight on them. The other way that we tell is by diaper count. What goes in must come out. If baby is getting enough food in their bellies, they are going to be having lots of wet and dirty diapers. We look to see on day 1 for at least 1 wet diaper and 1 dirty diaper. And then by day 4 or 5 for about 6 to 8 wet diapers and about 4 poopy diapers. And the color of those poopy diapers are going to change also. So it's going to start out that black tarry meconium diaper, and it's going to transition to a really dark green and then a lighter green and then that yellow seedy breastfed baby poop. So the color of that dirty diaper changing too shows us that baby's getting enough to eat. So, if you have questions about if baby's dirty diapers look like they should, you can call or text us on the helpline, and we can help you with that. We also want to look and listen for baby swallowing as they nurse. You can usually hear their little swallows at the breast, or you can kind of notice their throat drop down as they swallow. And that really just shows us that they are transferring milk, that they are getting something while they're nursing. We want babies to nurse 8 to 12 times in 24 hours. Those tiny bellies are going to equal frequent feedings, but those frequent feedings are going to equal a good milk supply for mom. Those first 4 to 6 weeks after birth, baby is really building up your milk supply for that whole first year or however long you plan to breastfeed. So we really need to nurse frequently in that time to really build mom's milk supply up to be all that it can be. This is the most important time to nurse frequently. We really want to go by baby's cues and nurse them anytime that they show those feeding cues or act like they are wanting to eat. Not only is it good practice for them to nurse, but it's good for mom's milk supply. All right, so how to get a good latch. So the first thing that we want to look for are those infant feeding cues, are really just the signs that baby is ready to eat. The earlier we can catch baby before they get really fussy and angry about being hungry, the earlier or the more calmly, I guess, latching baby goes, and the easier it is to get them to latch on. So really the main advice I can give is if they have been asleep for a couple of hours and you know that they are going to be ready or that they're going to need to eat, just go ahead and try to get them latched. Don't wait for them to start showing those cues. Just try to get them latched onto the breast. That's going to be your best bet. But watch for these other cues any other time to give you signs that they're getting ready to want to eat. And this video is going to show us some of those cues. Alright, so when baby goes onto the breast, we want him to go on with a wide open mouth, like they're yawning, as wide open as they can get it. If you look at the corners of this baby's mouth, they are really stretched open wide, where the corners of this baby's mouth, even though baby's mouth is technically open, the corners of baby's mouth are still really close together. We want baby to open really wide and be able to get a lot of that breast tissue in their mouth. We want them to really latch past that nipple onto the actual breast tissue. This video is going to show us an example of how to get baby to open up really wide and get a good amount of that breast tissue in baby's mouth.
Lightly touch your nipple to your baby's upper lip. This will make her open her mouth. Be patient. Wait for her to open her mouth very wide like a yawn. Then quickly bring her towards you so she takes a big mouthful of breast.
Alright. Now this video is going to show what happens inside baby's mouth. We want to get baby to open really wide and get a lot of that breast tissue in their mouth so that that nipple goes far enough back in baby's mouth so that it doesn't get pinched between their tongue and that hard palate on the roof of their mouth. So we want to get that nipple to go farther back in their mouth. And this video is going to show that.
Baby takes a big mouthful of breast with the nipple pointed to the roof of the mouth. the nipple reaches a comfortable area deep in the baby's mouth. With the nipple deeper in his mouth, he is able to suckle more effectively, triggering the milk to flow. Good attachment is the key to breastfeeding success. In contrast, in a shallow attachment, the nipple is centered in the baby's mouth, which is not wide open. The nipple lands under the hard roof of the mouth. As the baby sucks, the nipple gets pinched. This is painful and may injure the nipple. The baby is also unable to suck effectively and so cannot get much milk.
Alright, so in that example, that nipple is just barely inside of baby's mouth. Baby is pinching off that milk flow as baby is nursing because that nipple is getting pinched between their tongue and that hard palate on the roof of baby's mouth. So baby isn't able to drain that breast well or to really get a good feed. So it's really important that baby has a good latch because if baby is not latched well, they may not be gaining weight well because they are not able to get the milk out of the breast well. So if you're having pain with latch, baby might not be able to get a good feed in. So call us or text us on that helpline number, and we will help you with latch to make sure that baby is getting everything that they need from the breast. Alright, so when baby goes on to the breast, we want them to lead with their chin. If you can see in this example right here, baby's chin is kind of anchored into that breast. It is touching the breast. Where this baby over here, their chin is away from the breast. There is a gap there in between mom's breast and baby's chin. So this baby has a really wide open mouth. That chin is anchored into the breast. This baby, is probably just on the tip of that nipple, and there is a gap there in between baby's chin and the breast, and we don't want that. We also want baby to have what we call an asymmetric latch. Baby has more of the underside of mom's breast in their mouth, and you can see more of this areola above baby's mouth, where this baby just kind of went straight onto that breast, and baby kind of has equal parts of the bottom and top of that areola in their mouth. So we have a lot of women who are maybe larger chested who worry about baby being able to breathe at the breast. And with this asymmetric latch, with this angle, with chin anchored into the breast, and this asymmetric latch where you have more areola above baby's mouth, baby is at the perfect angle where it leaves a gap here for baby to be able to breathe. Where this baby, who just kind of went straight on, that chin is away from the breast, this baby's nose is kind of pressed into the breast. So at this angle, mom doesn't have to worry about if baby can breathe. So we're really looking for this asymmetric latch with chin anchored into the breast. This is really kind of what a good latch should look like. And then we want baby's body to be in alignment. We don't want baby kind of laying on their back looking up at the ceiling, kind of like how you would bottle feed a baby. We want baby to be turned in belly to belly, where baby's belly and mom's belly are touching. That way baby is turned into mom, and that creates a straight line between baby's ear, shoulder, and hip, so that baby isn't having to turn their head to get into mom's breast. That's going to help baby be able to swallow easier at the breast, and it is going to help baby be able to get in closer to get more of that breast tissue in his or her mouth. We also want baby's lips flared out like a little fish, kind of if you think of a suction cup on a window. That's how we want baby's lips turned out around mom's breast. It is kind of the wet part on the inner side of baby's lips that will form a seal around the breast to pull that milk out like a vacuum. And so if those lips are tucked under, baby can't get that seal around the breast. So in this example of a good latch, you can't really tell, you can't see that bottom lip because it's really kind of hidden in the breast. But everything else about this latch looks really good. I would say if mom isn't having any pain, I wouldn't really worry about that lip being flared. I would just assume that it is. Here in this example, you can kind of see that that lower lip is turned under. So I would just take my thumb and get it under baby's chin and just pull down on that lower lip and try to kind of flange it or flare it out. Same thing with the top lip. If the top lip was curled under, I would just kind of pull up on that top lip and kind of try to flare it out. And then we want to look and listen for baby swallowing. I don't think this video has any sound, but it will show you what it looks like when baby swallows at the breast. You can just kind of see baby's throat dropping down. And then if you have pain while baby is nursing, we want to take a little finger, get in between baby's gums and your breast, and break that suction and take baby off the breast. Unlatch baby. If when you take baby off, if your nipple comes out pointed like this, or if it has a line across the middle, or if it comes out looking like a tube of lipstick where it's kind of flat on one side, that means your nipple was being pinched in between baby's tongue and that hard palate on the roof of their mouth. We need to try to get more of that breast tissue in baby's mouth to get that nipple farther back. So try relatching baby, get more of that breast tissue in, get baby to open wider. Your nipple should really come out looking the same as it went in. It should not be misshapen or miscolored or anything like that. So if you're having pain, if your nipple comes out looking wonky, call or text us on that helpline number. We will help you. We will try to talk you through it over the phone. If we can't help you over the phone, right now we can try to FaceTime you. Once this COVID-19 crisis is over, we will try to get you into clinic to help you. We'll really do whatever we can to help you right now. But we will help you however we can to help you to get it fixed. So please reach out to us. We will help you however we can. But your nipples should not be misshapen or flat. That is a really good sign that something is not right with that latch. Pain or a nipple that is misshapen are the number one signs that something is not quite right with that latch. Laid back breastfeeding. This position that this mom right here is in is a really, really great position to nurse your baby in those early days and weeks. It looks like she is just on her bed. She's laid back. She's got pillows behind her, and she has the weight of baby more on top of her body than her sitting up, kind of over baby as she's nursing. This is really great for when you're doing skin to skin in the hospital. Really good for moms who have had a C-section to not have to be up on that incision. If you think about it, when you're sitting up with baby kind of leaned over them, gravity's pulling baby away from the breast. But when you're leaned back in a position like this, gravity is really pulling baby onto the breast. So a lot of times when we have moms that are having pain with breastfeeding, if we can get them into this laid back position, then as baby is nursing, gravity is really pulling them deeper onto the breast. So it really helps baby to get more of that breast tissue in their mouth. So this is a really great position to use in those early days and weeks. And then we also want to talk about safe sleep. So sleep-related infant death. SIDS fatalities are only a small portion of sleep-related infant deaths. In Missouri in 2015, 94 infant deaths were determined to be sleep-related, of which only 14 were diagnosed as SIDS. 80 infant deaths may have been preventable if safe sleep practices had been followed. Unintentional suffocation is the leading cause of injury death among infants less than 1 year old in the United States, with 82% being attributable to accidental suffocation and strangulation in bed. So what does safe sleep look like? It really looks like this kiddo right here. We always want to put baby to sleep on their back, both at nighttime and for naps during the day. We want baby on a firm sleep surface. We encourage room sharing without bed sharing. We want baby in your room, just not in the same bed you're in. Bed sharing may increase the risk of suffocation by 50%. No soft objects, loose bedding, or bumpers. And we encourage moms to breastfeed. Breastfeeding reduces the risk of SIDS by keeping baby in a more active sleep state. We also have the Safe Cribs for Missouri program, which will provide one portable crib per family, but it must be a last resort. If you have another crib or pack and play or a bassinet, they will not provide that. There are certain criteria or guidelines that have to be met. You have to be between 35 weeks pregnant and less than 3 months postpartum, and you have to participate in 3 home visits. You can call our office, and that number is 573-431-1947, and fill out the application for that online, over the phone if you need to. And then the videos that we used today, the latching videos were from Global Health Media, Attaching Your Baby at the Breast, which is a great video as far as latching goes. So if you have any further questions on latching your baby, that is a great video to look at. And then the 8 signs your baby is hungry was from Baby Center. So thank you all for joining us today. And if you have any questions, please call or text us on our breastfeeding helpline.